Hi, I'm John, and I work here at Evans Army Community Hospital in the Inpatient Physical Therapy Department. The purpose of today's video is to help you and give you the tools to have a successful outcome after your total joint replacement surgery. Hip precautions. Depending on your surgeon's surgical approach and technique, you may have specific precautions following your total hip replacement. Breaking these range of motion precautions can put you at risk of dislocating your new hip. Hip flexion. Bending past 90 degrees at your hips is often contraindicated. This includes bending over to put your shoes or socks on and bending forward to get up from a low chair or commode. Crossing legs, hip adduction. Moving your surgical leg past midline is the second precaution. This includes one leg over the other while you're sitting or while lying in bed, or crossing your feet down at your ankles. You will be issued a hip abduction pillow immediately after surgery to prevent this movement while you're in bed or sleeping. Hip internal-external rotation. Hip rotation restrictions vary depending on the approach. This involves rotating your toes inward or outward. Your physical therapist will let you know which to avoid. When in doubt, keep your toes pointed straight up when lying down or straight forward when sitting or standing. The following demonstrates not what to do when attempting to turn or rotate. It is important to keep your toes pointing forward. Pivoting. You want to avoid twisting or rotating on your new hip or knee during ambulation. You have two options when completing turns. You can either take your very tiny steps in the direction that you're turning while staying within the walker, or you can lift the foot of your surgical leg off the floor and complete the turn with all your weight on your non-surgical lower extremity. Sit to stand. When getting up from a sitting position, slide the foot on your surgical slide out in front to increase the hip angle. Placing one hand on the walker and one hand on the chair or surface that you are standing up from, push predominantly through your non-surgical leg while using your upper extremities to stand. Stand to sitting. When returning to sitting, be sure to feel the chair or bed behind both of your legs before attempting to sit. Once again, slide your surgical leg out in front slightly. Reach back with one hand to the sitting surface and carefully lower yourself down, being cognizant not to break 90 degrees at the hips. Notice how the operative leg stays within the 4 points of the walker. Stairs with handrails. Having a handrail available when negotiating stairs after a total hip replacement is ideal as it provides extra stability. Walk up the stairs using your walker. With the assistance of family or friends, slide the walker to the side and have them hand you one crutch. Place the crutch on the side opposite your handrail. Holding onto the handrail and pushing down through the crutch, step up using your non-operative lower extremity. Repeat until you've ascended to the top. Unless you have handrails on both sides of your stairs, your crutch will now be on the opposite side when going downstairs. While gripping the handrail, place your crutch on the step below. While maintaining a firm grip on the handrail and pushing down through the crutch, step down with your operative lower extremity. Carefully follow with your non-operative lower extremity. Repeat this sequence until you reach the bottom. Please take your time. Stair Closeup. In this close-up, watch the sequence of crutch, operative leg, good leg, crutch, operative leg, good leg. Stairs without handrail. When negotiating stairs without a handrail, the same sequencing applies, but you will utilize two crutches. Pushing down through both crutches, step up using your good leg, bringing the crutches up with the bad leg. Repeat until you get to the top. When stepping down, place both crutches on the step below, making sure that you are firmly in place. Step down with your bad leg, using the crutches to take weight off as needed. Then bring your good leg down to meet it. Repeat until you reach the bottom. Platform stairs. First, pivot until your back is facing the step. Move backwards until your ankles touch the step. Then place non-operative leg up on the step, followed by your operative leg. Lastly, move the walker to position yourself in the 4 points. Ankle pumps. Pull your foot back towards you, bending at the ankle. Then point your toes out straight like you're pressing a gas pedal. Repeat 10 to 20 repetitions. Quad sets. Complete this exercise with your heel propped on a blanket or towel roll with your leg extended straight out in front of you. This exercise can be completed in a sitting, reclined, or supine position. Simultaneously, pull your foot back towards you and push the back of your knee straight down towards the table by tightening the front thigh muscle, the quadriceps. Heel slides. This exercise can be performed sitting up with your legs straight out in front of you in a reclined position with legs straight out or while lying down. Place the middle portion of a belt, rolled up sheet or towel, or a stretch strap across the arch of your foot. Take a deep breath in. As you exhale, pull both ends of the strap, causing your heel to slide towards you and bending your knee. When you reach a point with increased pain and or stiffness, pause for a few seconds, take a deep breath in again, and as you exhale, pull again. Pause for a few seconds, then slowly release your grip, letting your heels slide away from you, returning to the start position with your legs straight out. Calf stretch with strap. Place the loop of your leg lifter or the middle portion of a rolled up sheet or towel around the ball of your foot. Pull the top portion of your foot back towards you gently. You should feel a slight pull in your calf and or in the back of your knee. Hold for 15 to 30 seconds as tolerated and repeat 3 times. This exercise can be performed as needed to relieve pain in the back of the knee that is common after a total knee replacement. TED hose. You will likely be required to wear compression stockings for at least 2 weeks following your surgery. These have multiple benefits, including reduction of swelling and blood clot prevention. It is very important to check your compression stocking periodically to make sure they are smooth and don't have wrinkles. Large wrinkles or bunching of your stockings can be painful, in addition to inhibiting the movement of fluid out of your joint. DVT. Deep vein thrombosis occurs when a blood clot forms in one or more of the deep veins in your body, usually your legs. DVT can develop if you don't move for a long time, such as after surgery or an accident, or when you're confined to bed. Utilizing the exercises previously mentioned and following your surgeon's and physical therapist's instructions can prevent DVT from occurring. DVT can be very serious. Signs of a DVT include swelling in the affected leg, as noted in this picture. Rarely, there's swelling in both legs. Pain in your leg. The pain often starts in your calf and can feel like a cramping or soreness. Red or discolored skin on the leg. A feeling of warmth in the affected leg. Deep vein thrombosis can occur without noticeable symptoms. If you develop signs or symptoms of deep vein thrombosis, contact your surgeon or physical therapist immediately. If you are having trouble contacting them, seek immediate medical attention. Pulmonary embolism can be life-threatening. If you exhibit any of the following symptoms, seek immediate medical attention. Sudden shortness of breath, chest pain or discomfort that worsens when you take a deep breath or when you cough, feeling lightheaded or dizzy or fainting, rapid pulse, coughing up blood. In closing, your physical therapy team is here to improve your return to daily life after a total knee or hip replacement. This video can be used as a supplement to your care, but regular physical therapy of follow-ups and exercise sessions as instructed by your physical therapists must be followed for full benefits and return to your daily schedule. We are here for you. Thank you for watching this patient education video. Be assured that with your hard work and our dedicated staff, you will reach 100% recovery. Care with honor.